I'm Matt Galsky. I'm a professor of medicine at Mount Sinai, and I'm the director of the genitourinary medical oncology program. For several years, we haven't had advances in the treatment of metastatic bladder cancer that spread to other parts of the body. And several years ago, a new type of treatment was developed called immunotherapy. It's loosely called immunotherapy, although more specifically immune checkpoint blockade. And these are medications that try and allow the body's immune system to attack cancer rather than attack it directly. There are reasons that we think giving chemotherapy in addition to these immune checkpoint inhibitors might be an attractive option. There are some scientific reasons for that. We think that giving chemotherapy first might actually destroy some cancer cells and make them more visible to the immune system. In addition to that, there are some practical reasons. We know that some patients might respond to chemotherapy, some patients might respond to the immunotherapy, and some patients might indeed respond to both. And by giving the treatments at the same time, we increase the likelihood that patients will respond to one of those components of treatment. So both scientific and pragmatic reasons for these combinations. Several years ago, based on that concept, we launched a clinical trial, which was the first trial that combined chemotherapy with standard chemotherapy used for bladder cancer with an immune checkpoint inhibitor called a CTLA-4 inhibitor. And in that clinical trial, we gave chemotherapy alone for 2 cycles of treatment in an effort to try and release some of the cancer cells' proteins into the blood so that they would be visible to the immune system. And then we added the immune checkpoint inhibitor. In that clinical trial, we learned several things. One thing that we learned is that there indeed seemed to be a subset of patients who responded quite well to that type of treatment, and in fact have remained without evidence of recurrence of their cancer several years later, including some patients who have stopped all treatment. And this is really something that would have been rare to see with chemotherapy alone. So we think that the immunotherapy is having an important effect in those patients. We also found that the patients who achieve those types of responses have certain genetic characteristics in their cancer, and we've been able to leverage both of those findings into our next generation of clinical trials. So currently we've taken that information, used the same chemotherapy, but used a newer form of immunotherapy called PD-1 blockade, and instead of using this treatment in patients with bladder cancer that's already spread, we're using this in patients who have localized bladder cancer that's invaded into the muscle layer of the bladder. Now, the standard treatment historically for muscle-invasive bladder cancer has been to remove the bladder surgically. And while that could be a curative treatment, it's certainly associated with some quality of life changes. And we think that these combination regimens, particularly in patients with these specific genetic changes in their cancer, might be beneficial enough that we can actually replace removing the bladder in some patients with just giving this systemic treatment, this treatment that's administered intravenously. And that's a concept that we're testing now. Mr. Parchman had a very good response to treatment on the clinical trial, but also a very interesting response in that the clinical trial involves phases of treatment, which first include chemotherapy alone, and then the combination of chemotherapy with immunotherapy. And we scheduled the treatment that way for a couple of reasons. One was a scientific reason because we were trying to release proteins from the cancer by killing cancer cells first with chemotherapy and creating sort of an internal vaccine that would then allow the immunotherapy to work better. And so that's why we gave the chemotherapy first, but this phased schedule of treatment has another effect. It allows us to assess the response to chemotherapy alone before we give the combination. So after receiving 2 cycles of chemotherapy, there weren't a whole lot of changes that were seen on a scan. There was no evidence of growth of cancer, but the areas of cancer were relatively stable. But after receiving 4 cycles of chemotherapy with the immunotherapy, the changes on the scan resolved. We didn't see any more visible cancer on the scan. We think that there are some reasons why that happened based on what we understand about the genomic makeup of the cancer, and those insights are being applied now to future clinical trials.
My name is Ramon Parsons. I'm the director of the Tisch Cancer Institute at Mount Sinai and the director of Mount Sinai Cancer. There's been a revolution in immunotherapy that's been going on now for about 4 years. And one of those places where this revolution has impacted is in the care of bladder cancer patients. We don't have just chemotherapy anymore. We have checkpoint immune therapy where we can now harness the immune system and let it attack the tumor. What Dr. Galsky has done that's remarkable for bladder cancer is that he's figured out that certain kind of bladder cancer patients that have a unique signature of genetic, I would call it a unique genetic fingerprint in their tumor, are really well suited to this treatment. They are the really, well, perhaps they are now because Dr. Galsky published a landmark paper demonstrating how important checkpoint therapy is for bladder cancer and identified important signatures that can help predict who will respond. In a very interesting clinical trial that's going to combine checkpoint therapy with tumor vaccination. We're hoping that the combination is going to further boost the immune system response, and he's doing that with Dr. Nina Bardwaj. Bardwaj is a world leader in understanding dendritic cells. These are cells that help prime the immune system's response to cancer, and often they're shut down in a cancer tumor setting. We're hoping that by priming those dendritic cells using a vaccine approach in combination with using checkpoint treatment, we'll be able to see even better responses and broaden the response in patients that aren't responding currently. Really well positioned to be a leader in moving this type of therapy forward for cancer patients. We think that we're building on a really great platform of success, and we have the team in place of great clinicians and great scientists to make a big difference in the lives of our patients. One of the things we pride ourselves here at Mount Sinai is trying to make our patients' experience as positive as possible. I mean, we understand our patients are often sick, they're going through a lot of stress, you know, this is a very emotional time in their lives. We want to make sure that we take care of our patients from not just their disease, but the patient as a person. And I can tell you one of the nice things about being at a hospital that takes care of all aspects of a patient, we are not going to be focused on just the specific disease. We're worried about the mental health, the nutrition, the well-being, the family. It means that anybody who comes in here, whether they have Medicaid, Medicare, or private insurance, they see the same doctors, and we make sure that that access is available to everybody. I met with Fred and Camille Parchman, and we learned about their story. Fred has bladder cancer, and he is now winning a battle against bladder cancer. It's really remarkable. He's done very well here. He's been getting treated with immunotherapy, and we're hoping, knock on wood, that his success will continue. I also am really proud to say that he's happy with his experience here. It's not just been about treating his disease, it's also been about treating him and making it a great experience for his family. And I'm very proud that Dr. Galsky, in this instance, has been a wonderful physician for them.
All right, yeah, my name is Fred Parchman. I live in Bud Lake, New Jersey. Initially, I had bladder surgery in New Jersey, and they thought that the cancer was totally contained in the bladder. But 6 months later, I got a call from the surgeon that it had turned into stage 4. And my whole family scrambled trying to find me a good treatment program. And to make a long story short, we landed up here in Mount Sinai, and I've been very happy with the treatment. I saw Dr. Galsky, and he outlined a course of treatment which involved immunotherapy. Oh, I definitely have made the right choice, and I also I was very lucky finding Dr. Galsky. I recommend it to anybody. The care was terrific.